You are the Canadian Donation and Transplantation Research Program. You are CDTRP.
The CDTRP is a network of more than 400 clinicians, senior, mid, and early career researchers, trainees, patient, family, and donor partners, and 100 partner organizations. Our network has supported 275 collaborative research projects and has mobilized research into policy change, legislation, commercial products, and improved knowledge for patients, families, and donors. Every year, CDTRP supports between $30 to $40 million in grant applications, something around 60 to 70 individual applications. You are CDTRP. These achievements wouldn't be possible without your hard work.
CDTRP Research Services is a platform that supports principal investigators to develop high-quality research in donation and transplantation. We work hand-in-hand with CDTRP investigators to maximize the effectiveness of research teams through support with funding development, project management, patient, family, and donor partnership, knowledge mobilization, events, and trainee support. Across the 5 research themes, we help teams mobilize new knowledge to ensure patient family donors, healthcare systems, partners, and stakeholders equitably benefit from research results.
If you are a basic scientist and would like support with your knowledge mobilization plan, if you are a busy clinician scientist with limited time for research but would like to run a multi-site study, if you are an early career researcher and looking for collaborators to help with your grant applications, if you value patient, family, and donor engagement, but are not sure how to find the right patient partners or what role they will have in your project, if you don't have full-time research staff, but need support.
We are here to help. Our experienced management team can support you at every stage of your research in donation and transplantation.
Now you are probably thinking, how can I request CDTRP Research Services support? The answer is simple. Go to the CDTRP Research Services Platform website, fill out the form to request support, and we will get in touch with you to discuss your needs. That's it.
We.
Nous.
Noi.
Nos.
Emis.
Nosotros.
Menk.
Kiano. We. Kiano.
Our CDTRP, and we will drive research advances so that every wish to donate is fulfilled and transplantation becomes a lasting and sustainable cure.
You are CDTRP.
Email us today.
Thank you very much, Charles and Laurie, for your presentation. That's very powerful, very interesting. So I'm now pleased to introduce our final speaker for day 1 of the CDTRP PFD Research Forum, Sue McKenzie and Kathleen Brown-Blake, for their presentation, Engaging Patients in Research and Policy. Since her kidney transplant in 2010, Susan has worked to support kidney patients and living donors by co-founding and overseeing the Transplant Ambassador Program, a unique volunteer-driven peer support program, which has been helping kidney patients and living donors navigate the transplant journey since 2017. She's also founder of the Kidney Patient and Donor Alliance Canada, a nonprofit which drives patient-led advocacy. Susan is an active patient partner who has contributed to several kidney research projects, including the Access to Kidney Transplant strategy in Ontario to increase living kidney donors and can solve CKD. Kathleen is a communications and knowledge translation specialist for the London Health Sciences Centre, Lawson Health Research Institute, where she translates research into communications for public use and implementation. She supports the ICE's Kidney Dialysis and Transplantation Program, and Dr. Amit Garg, Dr. Amit Garg's KDT research and the Pragmatic Trials Team, which is coordinated under the Accelerated Random Trials Platform at the Schulich School of Medicine and Dentistry at Western University. In this role, Kathleen supports researchers and patient partners across Canada as they spread research findings and implement those findings to better healthcare and health policy. So over to you, Sue and Kathleen.
Thank you, Len. It's great to be here. I think it is my turn to share screen, so I'm just going to start up our presentation. 1 second here. Okay. So as Len said, I'm Susan McKenzie. It's great to be here. I certainly have met many of you on the phone, and it's nice to have the chance to update you on where we're at with our project we're talking about today, which is engaging patients in research and policy through the Kidney Patient and Donor Alliance of Canada. We are well on our way to creating a national kidney donor and patient network dedicated to advancing research, education, and outreach. And this is very much a passion project for myself and for many of the other patients that I have the pleasure and honor to work with. So I'll just call out a couple of them who are here today, which is I see Charles is on the phone, Christine Pisapia, Charles Cook, and Len, of course, Len Hodder, who has also been one of our transplant ambassadors for many years. In addition, we work closely with Dr. Kyla Naylor, who's also on the phone, and she may be able to weigh in as well. So I'm just going to move right in to the next slide. So the Kidney Patient and Donor Alliance was actually incorporated as a Canadian nonprofit in 2019, and we've really just in the last couple of years begun to make some meaningful advancements. We're dedicated to uniting and amplifying the voices of kidney patients, living donors, and their families, so that we can play a meaningful role in improving the lives of those affected by kidney disease. We're striving to inform and educate patients and donors about issues that affect us, and to empower fellow patients and donors to help advance kidney care and the kidney community. And we certainly believe that this is a gap that's been out there, and that we as patients and donors who work together in kind of this grassroots style and lead our own work can really make a big difference. And that's why I'm going to share some of the stuff that we're doing right now. I also believe, I think that I'm sure that people on the call would also agree that patients and living donors, I'm sure you've been talking about it all day, that we have a unique opportunity, a credibility and an authenticity to advocate for an accountable healthcare system. And that's certainly top on our list of things that we're trying to do. We started out with a board of pioneers in 2019. All of us came from the ranks of the CanSolve CKD project, which many of you, I'm sure, are familiar with. So we had some good experience as patient partners, and really, I think all of us felt very empowered to do more. We really felt that there was much more that we could do. And that's when we got together to create this organization. So as I mentioned, our goal is to create a network of patients and donors and family members across the country to shine a light on kidney patient and kidney donor care gaps, We support each other through our lived experiences as a group, and this is far beyond the Transplant Ambassador Program. This is, as I mentioned, a national endeavor. We really feel that advocating as an organized group has been a real gap in the system, both for kidney patients and for transplant patients and donors. And we think that we can really play an important part in creating some tangible improvements and advancements. We have started already to work in collaboration with many researchers and clinicians across the country, as well as other stakeholders, and we are certainly looking to build those collaborations and partnerships with everyone who's aligned with our mission and goals. One of the things that we really believe strongly, one of the things that we found in our work is that any one of us alone, we can talk about the importance of change and advancements, but alone we can't do very much. Working together, we can do much more and have a bigger impact. And that's really what we're trying to accomplish. So this is a busy slide, but it is a glimpse at our organizational structure that has been developed again since we were established in 2019. We now have a charitable arm of the foundation of the alliance called the Renal Patient and Donor Foundation, which is a registered Canadian charity, through which we can operate some of our charitable programs and services, which include the Transplant Ambassador Program. So even though the Transplant Ambassador Program started out as a research project with London researchers and implemented with the support of the Ontario Renal Network, it was a research initiative, and we felt from very early on that we wanted a permanent place to live, that we wanted to ensure TAP sustainability, and this was one of the ways that we could accomplish that and ensure that it stayed in the hands of patients and donors who were the most passionate about it and really wanted to make sure that it continued because we saw the impact of it. I'm not going to go into great detail about this slide, except to say that a nonprofit in Canada can do a lot more advocacy work than charity, which is why we established ourselves as a nonprofit, because we really felt that the biggest gap was around advocacy for patients and for donors, and not just transplant patients, but all kidney patients, and that we wanted to see some change. And I know that personally, in my discussions with lots of nephrologists and researchers over the years, and asking questions about potential improvements to the system, I was told a number of times, if patients don't speak up, that that things need to change, then things will never change. And that certainly had a profound impact on me over time. And so that's one of the things that we are working to do, is to speak up about some of the challenges that we've experienced, but also to work in a problem-solving and collaborative way to make those changes. We'll talk about a couple of our projects in a second, but what we'd really like to advocate for, and we really feel is critical, is transparency and consistency, standardization of kidney and transplant care policies, and equal access across Canada. We really feel strongly about disseminating best practice kidney research to a wide audience, and we believe that patients, again, have a really, really important and powerful role to play in the area of research dissemination and knowledge translation. And we're doing, all of our advocacy work has a research base to it, and we really are working very closely with the research team, to prepare all of the information that we are developing. And ultimately, we are working to create a speakers bureau of patients and donors who can speak to important issues that may come up, in government, in healthcare itself, or even in the media. And that's always been a bit of a challenge, to find the right patient for the right issue at the right time. Some of the examples of the advocacy work that we've been doing is really advocating for adequate funding for renal and transplant care and research, which we know is underfunded, but also likely could be allocated in a different way. So looking at that, we really want to see transplant increased especially living donation, because we know that there's certainly like a limit to how many, to the flow of deceased kidney donors. That there's the way to increase this is through living donation. It mentioned standardized care. How can we ensure that there are patients who can advocate for, certainly COVID brought home the idea that patients need to speak up for themselves around vaccines and issues that really affect us as like kind of immune compromised people for life. And there was certainly a real gap during COVID in terms of that coming through. To identify others who can do this work. It's a limitless pool. There's not just a few of us who can do this. One of the things that always struck me was why so few patients have been involved in research. And I think I still don't know the answer, but what we would love to see is a lot more patients in the pool ready to do more research. And certainly, I think from my experience, there's no shortage of patients who want to get involved in donors. And that's my third point here, which is that we really need a skilled pool of patient partners, research partners, and we need a much bigger pool than what we have right now. Because as Lori was talking about, like we do get tired. We're involved in many things, and part of I think what's critical to our work is that we have these next patients ready and able to come behind us and to continue the work that we started. We also want to create an accessible database of patients and donors that currently does not exist. And this is really through the patients identifying themselves and saying that they want to be part of it and having a mechanism where they can get involved. And what we also want to see is a two-way exchange of ideas between patients and researchers. So ultimately, through the work that we're doing and some of our committee work, we're identifying research issues that we would love to work with patients on. So kind of flipping the script a little bit to even give patients new ways to get involved. And when I say patients, I mean patients and donors, of course. So in addition, we're looking at a number of education and outreach initiatives. I mentioned the Transplant Ambassador Program. We now have 200 transplant ambassadors across Ontario, and we've started a program a year ago in the Atlantic provinces as well. And we certainly hear from a lot of patients, some of the barriers and the challenges that they're facing, and we have great people like Len and Christine and Charles who are supporting them and helping them every day. But I think we need a group that can really take those barriers and challenges and do something with them and really work to make change. Be more than just a listening ear, and that's really the work of the Alliance. It's not the work of the Transplant Ambassador Program; it's the work of the Kidney Alliance. TAP is also going into the third year of our webinar series. I just have to do a quick plug because we have a webinar next week, a week from today, on sharing your story to help you find a living donor, and we'll have a number of transplant ambassadors sharing how they did that. So just back to see if I'm on what number of, I don't know what slide number am I on? I don't see the slide number, so just want to.
You're on 10.
10. Okay, so I think that I want to pass this over then to Kat to take you through this. Would you, Kat?
Thank you. Good afternoon. My name is Kathleen Brown-Blake, and I've had the privilege of providing the Kidney Alliance with knowledge translation and implementation support for the last couple of years. As a high level, knowledge translation is defined as using high quality knowledge in the process of decision making. For healthcare, that means that knowledge translation is the translation of research findings and lived experience into strategies that advance research and implement policy and procedural change that improves healthcare and outcomes. Over the past 2 years, the Alliance has undertaken a large knowledge translation project. This has included collaborating with several researchers in the exchange of ideas and translating the findings from numerous studies that combined with the patient lived experiences and the donor lived experiences produces important information that can be applied to improve research, policies, procedures, and the culture of kidney care across Canada. For example, using the wide variety of professional and personal skills and expertise that the Alliance members bring to the table, the Alliance has developed and implemented a knowledge translation and implementation plan, which is designed to set out goals and key messages, identify stakeholders, knowledge users, and develop dissemination and implementation strategies that target specific audiences with the goal of having research findings implemented by policymakers, clinicians, healthcare administrators, and patients and donors themselves in their own self-care. They've also set up an advocacy network of patients, donors, and family friends who have put the work in pounding the pavement to let stakeholders know the changes that need to be made. And this network of patients, it's extensive. Between the Alliance and its partner TAP, the Alliance has access to more than 1,700 patient partners who are interested in improving care for kidney patients. The Patient Partner Coalition, which is one of the committees under the Alliance, and is primarily made up of 30 more, actually more than 30 at this point, patients and donors across Canada, was the first structured committee of the Alliance. They advocate right now for the Transplant First campaign, which calls for a system-wide reform of the Canadian healthcare system that prioritizes kidney transplant as the best treatment for kidney failure. They hold monthly meetings, sometimes more than monthly meetings, to translate knowledge from research into policy and practice and advocate to mobilize those findings to achieve more transplants. They've held, on March 6, 2024, they held the first annual Kidney Advocacy Day at Queen's Park. They focused there on the Transplant First campaign, and there they met with more than 50 Ontario government policymakers to discuss the need to increase kidney transplants, and they had a very successful day that day. They developed a policy brief that supports the need for change in how kidney transplants are organized and conducted in Canada. And additionally, since then, numerous individual coalition members have taken the PPC's materials and advocacy points to their own local media and legislators, which has led to some incredible publications of stories, podcasts, and interactions with policymakers and clinicians. Next slide, please. So what's next for the Alliance? The Alliance plans to continue to develop and market webinars aimed at informing the public, patients, donors, providers, and policymakers, and providing important engagement training and informing them of the gaps in current kidney care system and potential solutions. They also intend to identify other advocacy issues beyond the Transplant First campaign that are important to patients and donors and build campaigns on them to advance care in other areas of interest. They are expanding their network of patients and donors daily, giving a voice to those who hope to play a bigger role in improving care for kidney patients, and plan to collaborate with other stakeholders in the transplant and kidney field to implement change and accelerate advancements in research. They are promoting a comprehensive mechanism where the Alliance connects patient partners with research projects where they can play a meaningful role, meaning these patients would contribute to the design, implementation, and knowledge translation of the research projects from the start to finish. As part of this, the Alliance has a plan to develop a list of patient-donor important questions that can be answered through research and to enrich the research being completed. Finally, they are seeking funding for research and advocacy initiatives to advance the implementation of research findings and improve care for kidney patients across Canada. The Transplant First Patient Partner Coalition is going to be publishing its white paper in the next few months and plans to expand the Kidney Advocacy Day across Canada and hold it annually, providing policymakers and healthcare providers with information they need to improve the healthcare system, and expand their outreach even further with individual coalition members contacting media outlets and additional policymakers to spread the Transplant First key messages. In this way, and many others, the Alliance is transforming the way we conduct patient partner research and can serve as a framework for other research groups. Last slide, please, Sue. The Alliance is growing this network, and you are invited. They want to build and collaborate to spread advocacy, to get patients involved in research, to improve kidney care. This is the link to the website. If you'd like to join the Alliance or have any questions, please feel free to contact us. We welcome you to add your voice to the call for change. That's it.
Thanks, Sue and Kathleen. That's an awesome presentation. Transplant Ambassador Program is one of those things that's kind of close to my heart. So it's one of the first volunteer organizations that I got involved with post kidney transplant. So it's really great. So if we have some questions, everyone feel free to raise your hand or to post it in the chat box. I do have one that we can get started with here. So how does the Alliance fit and align with the work of the KFOC and CanSolve?
Sure, I can take that one first. I think that we're completely aligned. I mean, we are working to support patients and donors, and you know, our objectives are exactly the same. The difference, I think, is that we are all patients and donors, and that we feel that we have an important voice that we should be facilitating on our own, that we should be moving forward to creating the community of patients and donors that can respond quickly to issues and that we can bring patient voices to light quickly. I mean, we're all in this together. We're all working for this toward the same goals, but I think we're doing it in a slightly different way and filling some of the gaps in you know, kind of direct patient advocacy that weren't there before. So I don't know if that answers the question specifically, but I'm happy to clarify more. I don't know, Kat, if you wanted to add anything to that.
I think it's good.
Okay. I don't see any other questions in the chat. I'd like to ask one. So I know your the Transplant Ambassador Program is Ontario and Nova Scotia currently, I believe. Is there a how does the future look as far as the Kidney Alliance and you know, the broadness of reach and so on?
Yeah, so we are having discussions with other provinces about implementing TAP in other provinces, and certainly is our hope that we'll be able to move forward in a couple of other provinces in the next you know, year, 12 to 24 months. So we are, you know, really the Transplant Ambassador model is almost like a franchise, and you know, we can really implement it anywhere if we have a supportive hospital to work with. So we have been speaking with the hospital in BC about piloting TAP in their hospital, and I just have to work through some of the details there. But we are more than open to talking with anybody about doing TAP anywhere else.
Okay, great. I have a question here from Joseph. Hi, does the Kidney Alliance have a relationship with IROC, the Pediatric Kidney Transplant Collaborative comprised of numerous children's hospitals?
Not at this time. It's certainly something that we'd love to develop. Absolutely. So if that's an organization you're involved with, I'm happy to talk to you. We'd be happy to talk to you and see what we could do to, you know, join forces.
Okay, and Linda just has a comment here, a huge opportunity to connect with other advocacy groups to expand advocacy scope and reach and learn from each other.
Absolutely. 100%.
Okay. No other hands up or any other questions? So one other one. How do you see the Kidney Alliance working with partners such as the CDTRP? How does that?
Well, again, you know, I think it's all of us are, you know, kind of working to accomplish different things in the same space. The transplant space, you know, I think traditionally has been a little siloed, you know, regionally and, you know, doing the provincial work and the federal work. But I think that there is way more opportunities for all of us to work together. We do cross promote with CDTRP. I mean, really it's about getting, you know, for us, it's about getting the right information in the hands of patients and connecting them with all of the supports that are out there available to them. So I think we can really collaborate on specific projects, but we can also collaborate in terms of making sure that we're in all the work that we're doing, we're also outlining all of the supports that are available to patients, and that it's not such a difficult journey to find support, whether you're a patient or a donor, that it's easy. And if you talk to any of us, we can direct you to each other and all of the supports that are out there. And every patient's going to find, find the support they need, perhaps in a different organization or perhaps in a combination of those. So it's just, there's not enough support, no matter how you look at it. We need more support, and let's take advantage of all of the ways that we can work together and support patients. And that's just really about being able to come to the table, I think. Come to the table and have these conversations. And even today is a great way that we can collaborate and get the word out together.
For sure. Absolutely. Okay, if there's no other questions at the moment, then I guess we can wrap it up. We're just a little bit over time. But thank you very much, Sue and Kathleen, for your presentation. That was really, really great. And thank you all for joining us today. And we hope you've learned more about the role of the patient partner. And with that, join us tomorrow for day 2, starting at 11 a.m. Eastern time. Please use the same link you used to access today's session. For those not joining us tomorrow, please share your thoughts on today's event in our survey through the link posted in the chat. And that's it for today. Thanks very much, everybody. Have a great evening.